You know, it's kind of funny how one of our greatest achievements, the fact that we're all living longer, healthier lives, has accidentally created one of the biggest challenges of the 21st century. It's this wild paradox that's pushing healthcare systems all over the world to a real breaking point. And in this explainer, we're going to dig into exactly how we got here.
And that's really what this all comes down to. It's a massive, delicate balancing act, just like the slide says. We've got the healthcare we all want and need on one side, and the hard numbers of our demographic reality on the other.
So this is the central question, isn't it? How did this incredible win for humanity, living longer, suddenly become this huge threat to our economic future? It's a fascinating and, frankly, a really urgent thing to unpack.
Okay, so to really get our heads around this, we first have to look at the massive demographic shift that's been happening right under our noses. And look, this isn't some theory about the future. No, this is happening right now. In a lot of countries, the proportion of older citizens is absolutely skyrocketing, and it's changing the very shape of our societies.
What you're seeing here are two powerful forces just pulling in completely opposite directions. On the one hand, life expectancy is way up, which is awesome, right? But on the other hand, birth rates are dropping, and the result? You've got a society with way more retirees and a lot fewer young people coming up to support them.
And that right there is the core of the problem. You've got more people who need more medical care for much longer, but the pool of money and resources to actually pay for all that care is getting smaller and smaller. It's a classic squeeze, and our healthcare systems are caught right in the middle of it.
So next up, we're going to see how this demographic pressure is literally cracking the foundation of how we've paid for healthcare for generations.
You know, for decades, this system worked like a charm. It was a simple, unspoken deal, a social contract. The young and working generations pay into the system to take care of the old and retired, trusting that one day the next generation will do the same for them. But what happens when the math just doesn't work anymore?
Well, you get a chain reaction. First, the workforce shrinks. That means fewer people are paying taxes into the pot, so the burden on every single worker who's left gets heavier and heavier. And the end result? The whole funding system just gets squeezed until it's ready to burst.
And get this, while the money coming in is shrinking, the costs are absolutely exploding. We're not just talking about a doctor's visit here and there. The really big drivers are things like managing chronic conditions for years, the insane price tags on cutting-edge medical tech, and the billions it takes to research and develop new drugs.
This quote really just says it all, doesn't it? It perfectly captures the high-stakes dilemma that leaders are facing. There are no easy choices here. It's like walking a tightrope between providing compassionate, dignified care and, well, not bankrupting the entire country.
So, if the old model is breaking down, what's next? Well, that brings us to the urgent search for solutions.
A lot of smart people are looking at this, and a few ideas keep popping up. Of course, the best way to save money on healthcare is to keep people healthy in the first place, right? So preventative care is huge. Then there's technology, like telemedicine, which can make things cheaper. And of course, just making the system run more efficiently. But a really big one is that we just need more people, more staff on the front lines.
But, and this is a really important but, none of these are a magic bullet. They're not simple flick-of-a-switch fixes. Each one comes with its own massive set of challenges.
Yeah, let's just take that staffing idea. It sounds simple enough. We need more nurses. But it's not like you can just post a few job ads and call it a day. We are facing a global shortage of nurses. Countries are competing for them, which makes recruiting and just keeping them on the job an incredibly tough problem to solve.
And all of this leads us to our final section, which is maybe the most profound part of this whole thing. This crisis isn't just about spreadsheets and policy anymore. It's forcing us to rethink the very idea of our social contract.
We're way past just talking about economics now. We're really having to confront these deep, fundamental questions about what we value as a society, what we owe to each other, and what kind of future we really want to build.
And as you can probably guess, there is no agreement on which way to go. On one side, you have a lot of younger people who are really worried about the massive financial burden they're going to inherit. Some of them are pushing for big reforms, even privatization. But on the other side, you have a lot of people who are terrified of losing their access to care, and they're demanding that the government step in and protect it, no matter the cost.
The stakes here, they really couldn't be higher. The choices that countries make today aren't just about balancing a budget for next year. These decisions are going to set the course for our societies for decades, maybe even longer. They will define the relationship between all of us for generations to come. And so ultimately, this entire massive, complicated issue really boils down to this one powerful, unavoidable question. As our world gets older, are we going to find a way to make sure quality healthcare remains a fundamental right for every single person? Or will it slowly become a privilege that's only reserved for a few? That's the choice we're all facing.